about how resources could be used to address the challenges in and around the area. So, starting at 2001 and moving forward until the city began to have a serious investment strategy to house people with the establishment of the Affordable and Supportive Housing Trust Fund, and that was in 2005. And that's when, in my opinion, when things really began to change and the production of housing units for people who were homeless really took a dramatic upturn. We really needed to address this condition more than any city in the country because we had so many people who were chronically homeless living on the streets, basically. You can see by the slide the semi-annual HUD mandated homeless count in 2013 shows a chronically homeless population of over 10,000 individuals, which is far and above any city in the United States. Now, 25 years ago, if you were homeless in Los Angeles, likely within 6 months, if you had some interface with social services, you would have been housed. Now, the average length of someone on the street is 8 years. That's the average.
Wow.
It's obviously got to change. Now, policies have changed and constantly evolving. Our numbers demanded change, and I'd like to think that our consistent effort to push together with the county and the city working together, that we began to move the dial with the development of supportive housing and funding what I felt was important, an emergency year-round shelter program as a place for people to start to prepare them to be housing ready. The federal government started to pay more attention to what the city and the county were doing, or in some cases not doing, with our federal continuum of care resources and the U.S. Interagency Council on Homelessness, which was established by the White House. Now, the continuum of care, as defined by HUD, Housing Urban Development, as a regional-wide approach to solving homelessness. Last year, our region received $77 million. $47 million of that was dedicated to permanent supportive housing. Now, working with city and policy stakeholders and LA County, we're now in the process of implementing several groundbreaking initiatives to coordinate housing and homeless services. Our initial strategy has been to implement coordinated assessment and intervention systems, as was mentioned by your previous speaker, that are very population specific and focused on those who are most vulnerable. Now, in 2010, United Way of Greater Los Angeles released the Home for Good plan to end homelessness, and the plan was updated in 2012 with a goal of ending chronic and veterans homelessness by 2016. This was the first coordinated private sector effort by business interests to be involved in the development of homeless policy, and most importantly, I think, to act as ambassadors for homeless initiatives. Stakeholders have been piloting a coordinated entry system for single adults in partnership with homeless providers, the VA and county departments for health and mental health services, and with the Corporation for Supportive Housing, United Way, and both city and county public housing authorities. Persons assessed by this eight nonprofit partner agency are prioritized for housing, and the common assessment tool used is the Vulnerability Index Service Prioritization and Decision Assistance Tool, and you know it by its acronym, I'm sure. Outreach and place-based access day shelters provide street-based contact, either through street outreach activities or walk-in capacity or an in-day shelter or an access center locations. In addition, the county-wide info line 211 is integrated with our homeless assistance program to serve adults and families and young people with immediate help and resources. Now for housing, the continuum of care has adopted a housing first model. It's a form of triage for households directly to the most appropriate intervention to meet someone's needs. Now, during the last 2 years, LAHSA, and you know what that means, the Los Angeles Homeless Services Authority, and the Chief County Executive Officer and Shelter Partnership, and the City and County Housing Departments, and the local TANF agency have been collaborating on the implementation of a coordinated system for homeless families and children below the age of 18. And that's been working on. I don't want to be redundant because I know you referenced that. No, it's fine, it's fine. So just put that where it is. Now, let me just skip ahead to the increased coordination. I did listen to what you were saying. I was taking notes. The increased coordination around homeless families is reflected in the most recent homeless count, which indicated a 25% reduction in homeless families in 2011. This should be noted as a clear measurement of the effectiveness of a coordinated entry system. Now, from an innovation perspective, and I know you mentioned the Family Solutions Centers, the Housing First approach and with an integrated resources from both the city and the county is a first for both of us. It includes the crisis intervention and the diversion and the rapid rehousing, the housing-related case management, and from my current position, I think it's even more interesting, the employment resources to prevent families from falling back and making sure that they stay out of homelessness or rapidly exiting families from homelessness. Now, each regional family solutions center has an outstation TANF-funded homeless case manager, which is also very innovative. And even more interesting is the inclusion of mental health counselors on site. TANF-funded substance abuse counselors who provide access to specialized services in support of stable housing. So everything revolves around the need of the family. These 8 community-based providers experienced in rapid rehousing models operate the coordinated family service centers. Now, this training, again, helps people remain housed. Both examples of innovation that I just noted and were previously noted for people who are chronically homeless offer a coordinated, integrated system of case management. And I think that the slide, again, still shows that we have more work to be done, and the challenges are ongoing, and the size and the scope of the problem will continue, even though we've made progress in our targeted demographics. Some of it is the sheer geographic size, the physical size of the areas that we seek to serve, and that homeless people are found in every part of Los Angeles County. Now, if you look at the slide closely, the areas indicated point to specific areas representing the locations of the Family Solutions Centers. And I guess it's no surprise, but 5 of them are located in the city of Los Angeles because of the high concentration of people who are homeless in the city of Los Angeles. Our city has been the point of entry for most of the homeless populations in the region. I've always believed, and I have said since 2001, that needs to change. 1 city out of 88 in the county of Los Angeles cannot be responsible for the management of this challenge, a challenge this large. These prevention strategies should be available for all homeless populations in their communities of origin or region-wide. The goal is to establish effective homeless programs and make them available to people where they live. Now that requires political will. And most importantly, cities must make provision for affordable housing and some type of shelter. Again, that requires political will and on a statewide basis, enforcement of that requirement. And I say all that to say, I do believe that we are on the right track, and successful programs that work have to be maintained and grown. if we're to impact homelessness in the region. So I can offer you some interesting anecdotes, but I don't think there's any more interesting than one that shows that an individual can make an enormous difference in policy development. Now, our previous speaker mentioned Dr. Katz, Dr. Mitchell Katz, and for those of you who haven't met him, who haven't heard him speak, he's an extraordinary individual who we were fortunate enough to bring here from San Francisco. He had a reputation in San Francisco that was enormous, and so it was very exciting thought of having someone of that caliber here. I reached out to Dr. Katz and told him we had a major challenge maintaining sick, homeless people in acute hospital care settings. They were too sick to be released into homelessness, and they continue to cost the county between $4,000 and $7,000 a day. So when we met, I said to him what I had said to the county 10 years earlier. Finally, we had someone who was receptive. A specialized supportive housing program that would include health and mental health care specialists on site. And fortunately, the stars aligned, and he said that was exactly what he wanted to do. I knew this when I was first elected in 2001. There were two major issues that needed to be addressed with homeless populations were housing and health and mental health care management on site. And to tell you that, you know, the dream or the vision that we had has begun to be realized. So on Wednesday of this week, I attended the official grand opening, although it's been open for a while, of the Star Apartments. It is an extraordinary site, and maybe you can take a trip there to see it sometime. And it's located at 6th and Maple in Skid Row. This project houses over 100 people living with serious chronic illness and disabilities. The Star offers on-site mental health and health care services with the goal of helping tenants avoid hospitalization. It offers a respite and health care services, and it was built by Skid Row Housing Trust. So Skid Row Housing Trust, there's two major nonprofit housing developers in the Skid Row area, and then one is SRO Housing. Skid Row Housing Trust did this, and they have 22 other supportive housing sites in and around Skid Row in the downtown area. Now, fortunately, with vision and political will and with money and resources, we've been fortunate over the last 10 to 12 years to get good design and good architecture. I'm going to say this architect's name because I want you to remember it if you go and visit various facilities, including the Star Apartments. His name is Michael Maltzen, because he is light years ahead of where other people have been in terms of designing housing for people who are homeless. He constructed this project on a podium of an existing building. So there are storefronts on the street level with clinic services, and the apartments were prefabricated and installed like Legos. It was faster, it was less expensive, and the record time that this project was completed. I am going to give some copies of some innovation health outcomes from a management system report that Mike gave us to show health outcomes in supportive housing, so we'll hand that out at the end. But in this case, the tenants of, this was the Star Apartment, and then another project, the New Genesis Apartments. Now, New Genesis is located on Main Street, north of 5th Street. So it's off of Skid Row. If you're ever looking for it, it's next to Peddler's Creamery. So it's mixed right in there where there is market rate housing. Now, in this supportive housing project, I wanted a mixed tenant base. All of the units are affordable, a range of affordability that also includes an opportunity for artist lofts. Now, we put artist lofts in there because that's what the community wanted. The people housed at the New Genesis include 75 tenants who were homeless and mentally ill. The rest of the people who are housed there are artists and people who are working and needed affordable housing. The homeless tenant health outcome study was done over 2 years, and the outcomes are clear. Supportive housing does work and retains homeless individuals in stable housing long-term in 95% of the cases. These are far better health outcomes, and that reduces the reliance on hospitals. I think it shows that supportive housing works and is less expensive than relying on hospitals and jail systems. The average cost, as I said earlier, of an acute care hospital setting is between $4,000 to $7,000 a day, against the average cost to house a homeless person of approximately $10,000 a year. So you might ask, why not build the units needed for homeless people? Remember that homeless people are not the only people who need affordable housing. The city of Los Angeles is massively behind on the construction of affordable housing for working people, families, and seniors. And just as an aside, you might recall a campaign for a housing bond back in 2008, thereabouts. It almost passed. It's something that maybe your students may want to study and see if they can organize an effort to try to get on the ballot again. So the two main reasons for our being behind are costs and resources. And the second reason, and the one that you could influence the most, I suspect, is political will to do this work. Now, before the governor decided to dissolve the redevelopment agencies in the state of California, we did have those resources to devote to housing. Our city has lost over $200 million in tax increment on an annual basis because of this dissolution. But this was a policy decision, and in my opinion, it was short-sighted. So we are not rich in resources for housing. So in my current position as general manager of the Economic and Workforce Development Department, we seek to align our work source system with economic development, and in doing that, look for ways to incorporate employment opportunities for people who are homeless, veterans, and people living with disabilities. I've worked in conjunction with the Workforce Investment Board, which is comprised of 39 members appointed by the mayor. Now, partnership agencies are convened through what we call the Los Angeles WIB, Workforce Investment Board, and we have formal collaborations through memoranda of understanding and formal service provider contracts that are administered and managed and supported by our department. We call our department EWDD. We administer the Federal Workforce Investment Act resources that support adult work source and youth source programs. Our city recently redid our work source system, and in partnership with our service providers, we have a goal of serving 45,000 net new individuals in the city in the next 12 months. Each of these 17 work source centers are required to enroll a minimum of 10% vulnerable populations, including those living with disabilities, people who are homeless, reentry populations, and a 10% enrollment requirement for veterans. Now, the system has also been expanded with the establishment of an online jobs portal, so people don't necessarily have to get up and go wherever to Worksource Center to access. And for those of you who want to take a look at it, the first iteration of it is online. It's called jobsla.org, and that provides access to thousands of job opportunities in the state and the Los Angeles region in real time. In addition, each WorkSource Center will provide intensive services that include case management that is administered in a way to assess the client's job training and educational needs and to connect them with whatever they need in terms of social services. Now, we anticipate that 9,000 people enrolled in the system will receive this level of service, with about 4,500 of them placed in job training. This is funded with grants from the United States Department of Labor, or DOL, and the Workforce Investment Act. Now, we also have 16 youth source centers that operate to serve disconnected young people, ages ranging from 16 to 24, also using an integrated service model for clients. Working in collaboration with the Los Angeles Unified School District, the youth source system provides academic assessment, tutoring, computer training, counseling, mentoring for work readiness, occupational skills training, and alternative high school services. In Los Angeles County, 20 to 25% of fostered youth are homeless within 1 year of emancipation. To address low employment levels, low earnings, and increased risk of falling into poverty, our youth source centers capture and retain and restore clients by providing stability and a pathway to success, to have better earning potential, work placement, and obviously a place to live. City and county resources are dedicated for our higher LA's youth employment program. You may know it as Summer Youth. And the county was most generous in giving us a lot of money. I think it was $13 million, and we were able to get it out there into the communities very, very quickly. This is done in collaboration with the private sector. And this past summer, we were able to put 10,000 young people to work for 6 weeks with financial literacy training. Now, both adult and youth source centers are funded with federal workforce investment resources and operate with multiple community partners. Now, these strategies all feed into the prevention of homelessness, and these strategies work because they actually put people on a path that relies on best practices and community collaboration. Now, a couple of good examples of policy in the administration of these systems include the decision to co-locate services that can qualify homeless families and individuals with housing and support services, and also expanding access to employment information through our portal. It provides us with this opportunity to hit a much larger number of people seeking employment opportunities. So for people who are formerly homeless and living in some of the many homeless projects that we've funded and worked on over the years, computers are on site at all of them. They'll be able to access Jobs LA that way. The community partnership to leverage grants and improve program outcomes are all based on policy decisions made through collaboration, and increasingly to enable us to compete much more effectively for grants. It's based on experience and based on metrics. In the case of youth services, capturing disconnected youth and providing education assessment and plans, developing plans for reconnecting clients with education and job training and support services has yielded excellent outcomes. Now, the great thing about good policy development for you as students is the implementation. When you succeed, you attract and you qualify for more resources. And when you show success, success breeds more success. Now, our WIB recently received notice of an award. It was a $6 million Workforce Innovation Fund grant for Los Angeles. It's for Los Angeles Regional Initiative for Social Enterprises. You'll probably hear about this. It's called LA Rise, and when we leave here today, we're going back to plan the opening. This project will stimulate job acquisition and retention for the hardest to serve populations. People, again, who have a history of homelessness, incarceration, veterans, and disconnected young people. A key innovation of this program is the linkage of mainstream workforce systems with social enterprises. I mentioned Skid Row Housing Trust. They have a social enterprise which is called Piece by Piece. it's not only therapeutic for their clients, but they make mosaics, and they sell them. They sell them on site. Increasingly, they're selling them off site, and they sell them online. The Downtown Women's Center has a social enterprise on the ground floor where their ladies live. It's called their line is called Maine. I know that they sell their goods in Bloomingdale's. Now, this is going to be a unique partnership with the city and an organization called REDIP, and this is an employment social enterprise expert. The goal of the program is to serve 1,000 homeless people by the end of a 3-year program and place 500 of them in stable employment. Now, one of the greatest challenges I faced in the position that I serve now is we have our workforce system with the continuum of care, but the Los Angeles Homeless Services Authority does not yet include our employment data in their system. And with the change in leadership, I hope to be able to accomplish that very, very soon so that we can be much more targeted in the way that we use our resources. My plan is to bring the best homeless care providers that are working to restore their clients to independence together with our work source and youth source administrators and form a new working collaborative. This collaborative will regularly meet and confer on this new grant to establish best practice models and ensure positive outcomes. This is going to be a challenge because it's, again, I think the next level of interface. I've worked for many years on policy development, and I look back on some of the things that have been successful. One thing that jumps out on me is something called Proposition O, and it was a clean water bond, and it was one of those measures that we did that passed overwhelmingly. I think it passed overwhelmingly because we were able to tell a story in a very personal way about how it would affect people's ability to have clean water in their communities and what that meant for their health and for their future. And so I hope, again, and I want to throw this out here again, maybe a project for you would be to structure something to propose to your local elected officials on the housing bond. I originated the single-room occupancy hotel affordable housing preservation ordinance to preserve the city's remaining 8,000 SRO units as affordable throughout the city of Los Angeles. Many of these units have been upgraded for people who are homeless and for low-income workers. I also originated the patient anti-dumping ordinance after seeing a horrible video on television of an elderly woman dumped out of a taxi on Skid Row with her hospital bans still on. This prevents hospitals and institutions from dumping homeless patients against their will in Skid Row. And I wanted this for a number of reasons. Homeless patients should receive better discharge planning at hospitals than just a delivery by a taxi into Skid Row. And secondly, for years, I had advocated for more respite care beds for people who are homeless, leaving hospitals and needing ongoing care. And so I knew that without that law, nothing would change, and now things have changed for the better. A good policy maker is one that is solution-driven and wants to serve the best interests of the people that they represent. That is better than anything. You can move mountains with that. And, you know, we are here in California, so let's not forget policy change is often driven by organizations or groups that develop ballot initiatives that are passed by the voters. That's why I throw this housing bond idea at the group again. So our challenges are big, but I think that we're pretty big too. 1 in 7 Americans lives in California, making our challenges really quite large. Thank you for allowing me to give you some updates today, and I hope to work with you as you take up some of these challenges and become very strong policymakers and advocates in the future.